How does pharmacogenomics personalize neurotherapies? Imagine a world where your brain treatments are tailored just for you, based on your unique genetic makeup. That's what pharmacogenomics is all about. It studies how your genes influence how you respond to medications. When it comes to brain health and neurotherapies, this field is changing everything. Instead of guessing which drug might work, doctors can now look at your DNA to make smarter choices. Pharmacogenomics combines knowledge about how drugs work with your complete set of DNA. While most of our DNA is the same, tiny differences can make a big difference in how your body processes medication. These differences often involve proteins like enzymes, receptors, and transporters. They decide how a drug moves through your body, how it interacts with your brain, and whether it causes side effects. For neurotherapies, this means that two people with the same diagnosis might respond very differently to the same medication. Some might get relief, while others might see no benefit or experience adverse effects. Traditionally, doctors use trial and error to find the right medication, which could take weeks or months. Now, with pharmacogenomic testing, they can analyze your genetic profile beforehand. This helps identify which drugs are more likely to work for you and what dose is best. In practical terms, this is already happening in mental health care. For example, many patients do not respond well to their psychiatric medication because of genetic differences. Pharmacogenomic testing can guide doctors to choose medications with a higher chance of success and fewer side effects. The U.S. Food and Drug Administration now includes genetic information on some psychiatric drug labels to help guide prescribing. Beyond mental health, pharmacogenomics is helping find new drug targets for neurodevelopmental and neurodegenerative disorders. Large genetic studies have uncovered markers linked to conditions like autism and schizophrenia. Some genetic changes, like copy number variants, can spontaneously appear and influence how a person responds to treatments. As genetic sequencing becomes faster and more affordable, the potential to customize neurotherapies grows. It's important to remember that genetics is only part of the picture. Age, sex, diet, other medications, and overall health also play roles in how drugs work. The most advanced approaches combine genetic data with these factors to create personalized treatment plans. For example, algorithms that include both genetic and non-genetic factors can predict the best dose of blood thinners like warfarin. Similar models are being developed for neurological and psychiatric drugs. For those interested in neurotechnology, pharmacogenomics is a major step toward truly personalized brain treatments. Instead of a one-size-fits-all approach, therapies can be fine-tuned to each person's biology. This improves outcomes and reduces the risk of ineffective treatments or side effects. As genetic testing becomes more accessible and our understanding of the brain's molecular machinery deepens, pharmacogenomics will play an even bigger role in neurotherapies. In the future, a simple cheek swab or blood test could help determine the best medication for conditions like anxiety, attention deficit hyperactivity disorder, or Parkinson's disease. For anyone excited about the future of neurotechnology, pharmacogenomics shows how science is making brain treatments more precise, more effective, and more suited to each individual. Combining genetic data with other technologies like brain imaging or wearable devices could further refine neurotherapies and improve quality of life for many.